Welcome back, dear viewers, also to Saturday mornings here again after we just saw that cartoon segment also a little bit ago, which, let me say, lighten the day up a little bit after that press selection or the news selection. From that topic also, we moved to a topic also that me and Saima discussed today so much, and I think Saima knows so much about it. I think I was also, she gave me some good pointers also in the teeth and in the gum section. But we also have today, I'm a professional or a specialist, I'm Dr. Mzaffar Abu Zaid, a dentist, to speak to us also about the inflammation of the gums. Dr. Mzaffar Abu Zaid, good morning. Assalamu alaikum. Thank you, doctor. Doctor, first of all, when speaking about, for example, the inflammation of the gum itself, and then many would ask, for example, what is the inflammation of the gum itself? What does it do, and how sensitive also could it be, or how serious should I take it?
Okay, firstly we will talk about the definition of the gingivitis, what's called in dentist. This is gingivitis. This is the inflammation of the gums tissue. That's meaning the main cause for that inflammation is the bacterial plaque. This bacterial plaque, in absence of the treatment, will become what's called periodontitis disease. That's meaning that there is destructive of the tissue for the gums, and there is some symptoms that gingivitis gives some symptoms for the patient.
Good point.
If we talk about the symptoms, we talk about the swollen gums and the bright red. There is some bright red for the gums. This is not the normal. This is not the normal color for the gums. Okay. We talk about also the bleeding.
The normal color of the gum itself.
The normal color.
What is is dark blue a normal color, or?
No, of course no. This is for smokers.
For smokers.
Only, yes.
What should it be, for example, like
red,
the perfect color?
Red. Let's go to the orange. This is the normal color.
Pink is unusual.
Pink, yes, it's okay, but the gingivitis give the gums the color of red, bright red. Exactly.
Bright red. It's
bright red. This is the color for the gums, which for the patient which have the gingivitis, and give bleeding. This is the main problem for the patients that they came in the clinics, because they told, I have pain, I have bleeding in my gums, I can't brush my teeth. For that I don't want to brush my teeth because I have bleeding. This is the main problem, the main cause, that the chief complaint for the patient that they come to our clinics.
The toothbrush.
When they make brushing, they have bleeding in their gums. For that, they leave the.
Miswak is okay.
It's okay, but we must also use the toothbrush with the toothpaste. It's better together with the miswak. It's no problem for that.
Good points, doctor. Simon, I think the topics that you were also mentioning today, for example, you mentioned some good points, for example, regarding the whole blood case, the sensitivity actually of the gum itself. And I think the doctor also could, for example, mention it to us also in in a health way or in a medicine way, for example. How should I brush my teeth? I mean, how many times a day, for example, is the correct time, and how should it be also, for example?
Okay, this is the important point. How to brush your teeth. There is some patient that they told you that I brush my teeth how many times per day, but still the bleeding, still the caries. This is the first point. How to brush your teeth. You must, in the first time, you must choose the toothbrush it's compatible with your gums. For that, we use always the soft toothbrush, and we must change the toothbrush 3 months. After 3 months that you use, you have to change it. This is we will go to the gums until to go to the teeth. It's necessary to brush your teeth 3 days three times per day. This is
Three times a day. Three times a day.
yes.
Like in the morning, then after lunch, and then after dinner.
Before sleeping. This is important because the saliva, there is no saliva that's making as a tampon system for that's defense on the acid attack that's give in the last decades.
Good pointers, doctors.
Certainly, doctor. So, Dr. Mutafar, I think that one thing is very clear now to our viewers, that if they're having red gums, it does not mean that they're in good health. It means that probably they are having a problem. So if you have, like, you know, a nice pinkish tint to your gums, or even, like, you know, a shade of red, but it's not going to be looking like, you know, puffy or swollen. So you have to be very careful about it, and you have to observe it from time to time.
Yes, of course. So, you must go to the doctor. That's he know what's the problem exactly for your gums, because the bacterial plaque will transform in tartar. This tartar, this is the sharp substances that make bleeding for the gums. When you brush your teeth, you have the toothbrush will go to the between the gum and the tartar and make bleeding for the gums. For that, if you ask about the treatment, the first point in treatment is the prevention. Prevention by orally or by oral hygiene, daily oral hygiene. If the tartar is found, we must make in the clinic. We make that's called scaling and polishing. After that, we talk with the patient how the method how he use the toothbrush.
Actually, today me and Simon were also speaking about, for example, that Hollywood smile, you know, and how do they get it also on this, for example, that bright teeth and
yes,
what it does to you.
For treatment for the bright teeth, that's meaning there is we can make bleaching, we can make what's called veneers already.
Is whitening healthy for the teeth?
Whitening, it's not for daily whitening because it makes some attack for the enamel. For that, we can use by for 6 months or 3 months. It's okay for the bleaching, but the oral hygiene, it's important than make something bleaching or the veneers or treatment other for the teeth.
Certainly. Now, Dr. Munter, you have mentioned about gingivitis, the gums inflammation or a gum disease, which we get to see is quite common as well and very much heard of as well. Maybe a lot of people out there, they do not know what is gingivitis exactly, but they know it by the name at least because they hear it so commonly. Now, talking about gingivitis, Dr. Muthan, tell us as to how it is that a person would be able to know before going to the dentist that he may be having gingivitis. What are the signs and symptoms of it? What are the complications associated with it?
Okay, we will talk about the symptoms. We said that bleeding. This is the first symptoms that the patient that he can accept it. The trench mouth. That's meaning he has bad smell in his mouth. This is also one symptoms. For the complication, we talk about loss of the dent. Loss of the dent because the level of the bone will go to the third apical for the teeth. That's meaning we'll lose the tooth, or you can move it. You can see that the teeth is moving.
I agree. I think these points itself, by itself, I mean, when thinking about the teeth, there's also a method that in China that they say that they take their teeth out, for example, at a certain age to avoid such diseases, or for example, heart strokes or heart attacks. Is that true? And how serious also should, for example, a person take the teeth, or for example, or also visit a dentist, for example? How serious shall I take it?
I don't understand you. That's meaning that you talk about that some disease that's in relation with the gum.
Yes, exactly.
Yes, because the body is the resistance of the body is feeble. For that, it's very they have the ability to make some problems in gums, and there is some disease that they use some medicine. The medicine they take give the gingivitis for the patient.
So it is healthy for me actually to take my teeth out at a certain age, for example, to avoid such diseases. It's healthy.
No, we can make visit for the doctors by 6 months. Every 6 months you can check up in the clinic to give you is exactly what you have, what do you have, and what you must make it for your brushing or caries or everything that you have in your mouth.
Indeed. Now, Dr. Mutaffar, tell us about the inflammation of the gums in children as well. Now, we get to see sometimes the children, when they are brushing their teeth, they start to bleed, their gums start to bleed. But sometimes we would say or think that maybe the child applied too much pressure or hurt his gum somewhere. But is gum inflammation something that could actually be arising amongst children, school-age children even?
Yes. For the children, I think that there is two types to inflammation. There is inflammation, normal inflammation for the eruption of the teeth. Eruption of the teeth, that's meaning the definitive teeth will erupt. You can see the gingivitis or inflammation for the gum.
Yeah, and we
this
get
is
to
normal.
see that the babies are always using a teething ring for that as well.
Yes.
Yeah.
But for of course the children is the same of the adults. They can't the method how the food that they eat. This is also important thing that's include the gingivitis. Also the method how to they brush their teeth. The same of the adults.
Right, but these points, I think they're all excellent. But also something that I also focus on, for example, and a question also that will come, let me say, to a person's mind. Bad breath, for example, is it the effect of, for example, like the tooth itself or the gum, for example?
Okay, there is two cause for the bad breath. The first one is the problem for the gums, and the second time if they have caries, the food will collect in these sites. For that you can smell the bad breath.
So
For that you must have to treat the two causes to make it, and you can use the mouthwash that's called after the brushing. Mouthwash give you good breath.
Certainly. Now, Dr. Muzaffar, tell us, as Walid was asking you earlier too, that with the teeth, at a certain age, you could be more likely to get some diseases as well. So I was talking about the Chinese practice of removing the teeth at a certain age. But talking about us here in Saudi Arabia, we don't really do that. Now tell us, could there be problems associated with gingivitis? Let's say if I have gingivitis, maybe it's going to affect my kidneys or it's going to affect my liver or any other part of the body. Or maybe if I'm somebody who has high blood pressure and diabetes.
Of course, this cause will make that the gingivitis, but also we have the adolescent age for the hormones, the change of hormones, especially for the girls. That's meaning that affect the tooth to make gingivitis. Sometimes the stress make for the patient. It's not they can't brush their teeth. That's mean in the finally give the gingivitis for the teeth.
Indeed.
So that's the answer actually for it, is that there is actually diseases that could be caused by the teeth itself. But doctor, also, for example, me as a person or the normal person would also wonder, for example, teeth-wise, as important as it is and as sensitive as it is also, there may be also a big, let me say, also cause or effect, for example, on the person itself. So the teeth itself could affect, for example, like the heart, the kidney, People who have also diabetes on the other side, I think that's a very sensitive case because when they bleed, it's a big issue to them. So such an effect, for example, if they have, as you mentioned, gum, for example, issues or teeth issues, for example, what should they be doing, for example? How should it also they should take care of it?
Okay, for the patient that they have some problems, you talk about that.
Like a patient who's, for example, infected with diabetes. It's hard
Yeah.
for you also as a dentist to just go ahead and do a surgery on his face.
We can cover the patient by antibiotic before treatment for their safety, and you know that's the glucose inside the mouth. That's for the patient that's used insulin. They have lots of that problem, increase the probability for the gingivitis.
Good point.
But for the treatment is the same. But we must take care for
Because
them.
their teeth also gets affected, let me say, easier.
Plus then, because there is loss of bone. The problem is loss of bone for the diabetes. That's meaning you can see after we can see this patient three times per month. For they have loss of teeth and the movement of teeth.
Indeed. Now, with this, Dr. Mudaffar, also tell us about, for instance, people who are suffering through gingivitis. And lots of the time, people ignore dental problems, things as such. They usually ignore it until it really becomes like, major inflammation and they start to have many problems. But now people who develop gingivitis and they start to feel some of the basic signs and some complications with their gum while they're brushing their teeth or things as such. Now, how important is it for them to be immediately treated for it? And if gingivitis left untreated, what would be the consequences or the problems with it?
Okay, for the treatment, we must make the scaling, remove the tartar. This is the cause that make the bleeding. That can increase the problems for the patient. Lost the teeth. After that, we talk for the patient. That's 75% of the treatment is the patient. How to brush, the method, how to eat. This is important for the patient, especially for the children.
Indeed.
Yes.
Now, Dr. Mudaffar, what is tartar on the teeth? Could you explain it to our viewers?
Okay, the tartar is hard substances that's adhere on the teeth, on the surface, teeth surface. It's not easy to remove it in your home. We can make it in clinic by scaling. We can remove it by scaling and polishing. This is the problem. That's a lot of people they talk about it. I see something, I don't know what's this, yellow or sometimes it's brown.
And this is for almost, I think, every next person. What is the reason for developing tartar on the teeth?
This is in absence of treatment of the bacterial plaque. The bacterial plaque, if the patient they didn't remove it, it's transformed in tartar. Also, there is the gland, salivary gland, that give the magnesium, calcium. It's also increase this formation for the tartar.
So it's really important for us to be getting it removed. Now, usually you would all get to see tartar if you're going to look inside of your mouth. If you have a bathroom mirror where you have bright light on the mirror, you would be able to see usually, Walid, in the back of the front teeth, the top and the bottom, the teeth in the corners as well. You get to see there are blackish or brownish linings on them. So this is not the designing which is supposed to be on your teeth, and we have to be very careful. And I think mostly Dr. Mudaffar, maybe up to 80 or 90% people do have it, right?
Yes, of course, because especially for the teeth in the difficult how to brush.
Yeah.
Inside the what's called lingual face for the lower teeth incisors and for the molars, upper molars.
Indeed, but let's say if somebody comes to your clinic, let's say if I come to your clinic and I have scaling and polishing. Now, how long, if I have scaling and polishing, would all the tartar from the back of my teeth be completely gone?
Of
I would have even color front
Yes.
and back. Okay. Now, would it start building back up again after a while?
Maybe 1 or 2 days after the scaling, you still the bleeding. After that, when you use the toothbrush as the method that I talk about it, and the mouthwash, the bleeding will stop.
So, after scaling, everybody is likely to have bleeding.
Of course, maybe, but the mostly yes.
Mostly people have
Yeah,
bleeding
yeah,
after
of course,
scaling.
yeah.
Now, after you finish the scaling, how soon it is that you would be getting those stains again back on your teeth?
Okay, there is that's meaning the food, the coffee, the tea. That's mean make stains in your teeth. For that, you must brush your teeth. This is the problems. It's mostly for all the people that they can't live without coffee, without tea. For that, they must brush their teeth. For make for that's meaning good for the patient that they can see your teeth brightness, and there is no complications.
The color of the teeth, doctor, let me say. For some it's white, some it's off-white, some it's yellow. Or although they do brush their teeth on a daily, let me say, daily, every day, twice a week. But but you still see the color of the teeth. It's a little bit yellow.
Okay, for the color of the teeth, it's differentiate between the patient, between the people. The same of the color of the skin. That's meaning
Really?
not all the people have white colors for the teeth. There is degree we call shades in dentist. We have shade A1, A2, B1, B2. That's meaning not all the people that have the white color for their teeth. We talk about fluoride. Fluoride, this fluor, the quantity of fluor that's differentiate between the
It depends
color.
on the color of the skin. You meant, like for example,
No.
a person with dark skin would have like whiter teeth or
Maybe
not
yes.
white teeth.
Maybe
Really?
yes. For the dark color for the skin, they have white teeth.
And then the
White
opposite.
teeth, or maybe Walid, we can say they look white.
Yeah.
Because let's say if right now I put on, like with my skin color and everything, if I put on brown lipstick, then my teeth are usually likely to look very white. But I mean, because I see it in
Yes.
pictures that every time it is that like females would be wearing like brown or dark brown shades of lipstick, their teeth look fair. Whereas when they, I mean, their teeth look white, and when they wear like red lipstick or pink colors, their teeth look like kind of a little bit yellowy.
Yes, but we will when we choose the color for the teeth, we choose it without any what's called
Light?
light. Yes, for choose the exactly color for the teeth.
Right. Now, Dr. Mudaffar, tell us, is it important for us just to judge our teeth when we stand in front of the mirror? Is it important to match the color of our teeth with the white of the eye?
Extend you.
Like in our eye, we have the white color, right?
Yes.
So is it like a standard for us to
no,
measure
no.
that how white our
Of course,
teeth
no,
should
no,
be?
no,
No,
because-
okay.
It's not the same.
Because lots of the people say this, that the white of your eye should match the white of your teeth. So even when you have dental whitening done, that you should not make it like, you know, like the
whites.
white of Dr. Mutaffar's jacket or the white of your toothbrush should not be in the teeth.
That's actually good because many always aim and and hope also and try a lot to do to have that Hollywood smile. That's really white teeth. So that's unhealthy actually, as you mentioned to us, is to have such a white teeth, too much white teeth. But Dr. Mzaffar, at the end of this, let me say a very interesting segment. I'd like to thank you personally.
Thank you.
Thanks a lot for the information that you have given us here today. It was a pleasure. We enjoyed your time, and I hope also that the viewers did the same. And also the viewers, if you do have any questions also about regarding teeth, dental, gum inflammation, also always email us on saudimornings.ksa2@hotmail.com. And we'll be happy also to send it to Dr. Mzaffar.
Okay, no.
Dr. Mzaffar, I think you'll reply, no problem in your case, right?
Thank you very much.
Thank you so much, Doctor. It was a
Thank you.
pleasure. Thank you.
Thank you.
Simon, of course, we did unfinished, let me say, our segment here of the dental inflammation of gum to the report also regarding global and economy. So stay tuned.